This treatment option, the intermittent hypoxic respiratory training, of course has the main mechanistic improvement of kind of respiratory function. So a potential target population for this treatment to test the efficacy should be patients who have some kind of respiratory and functional impairment. With this in mind, the patient cohort or the patient population of patients with long COVID complications are kind of an ideal patient population to test this treatment option. The hypothesis is that it improves respiratory functional capacity, and those patients have the particular problem of impaired respiratory function, both in the lungs and also on a cellular level, where respiratory function in the cellular muscles, in the muscle tissue, for instance, is impaired. These patients with long COVID looked for us very intriguing to test whether there is an efficacy benefit of this treatment option, particularly in those patients. Is in controlled hypoxic conditioning, so forcing those patients to breathe a low oxygen air, which resembles to some degree in high altitude training that we know, for instance, from sports athletes to improve their functional capacity. And we do this in a controlled, monitored way, only for a very short period. And this controlled short period will allow for a conditioning of the respiratory function of the skeletal muscle. And we do this with ongoing safety control mechanisms in place. And as soon as certain trigger points are met by the system, then the hypoxic phase is switching into a hyperoxic phase. So what we actually expose those patients is to undulating hypoxic and hyperoxic breathing air. And this change in the oxygen concentration in the breathing air is actually a strong stimulating factor for improving respiratory functional capacity within the cells and also within the lung tissue. The novel treatment option of intermittent hypoxic respiratory treatment was applied in our trial with a medical approved and certified device which uses built-in safety measurements to switch automatically from hypoxic to hyperoxic conditions upon certain trigger points which are derived from a continued monitoring of the patient's cardiovascular and respiratory function. Usually an improvement in 6-minute walking capacity on average of a certain cohort of 30 meters is considered a clinically relevant improvement. What we observed in our pilot trial was a 90-meter improvement of 6-minute walking distance, which is about a 3-fold improved functional capacity. That is a quite impressive improvement with this novel treatment option. We demonstrated a beneficial effect on the functional capacity of those patients. We demonstrated a beneficial effect on the symptomatic status of these patients. And we have also demonstrated a beneficial effect on the quality of life of those patients. All three very encouraging to move forward and explore the efficacy of this treatment in patients beyond the long COVID syndrome. This could be patients with cardiovascular diseases in general. This could be geriatric situations. This could be patients after long-term illness with delayed recovery after some severe hospital condition. Of course, those patients appeared to us as the ideal cohort of patients where respiratory problems are the key target for rehabilitational improvement. But having observed a benefit here in those patients, of course, is very encouraging to move forward to patients with other cardiovascular or respiratory diseases to see if we can replicate the beneficial effect also in those patients.